Recording, okay. And this presentation is the third in our series of ICD-10 training webinars. It is called the Transition Team Training Series. And what we're going to be talking to you about today is not going to be much by way of ICD-10 coding or the structure of ICD-10 codes. This particular presentation really doesn't have a lot to do with that. This presentation is designed to help us get prepared as an office and as your billers for the ICD-10 transition. We have several objectives that we want to meet today. In our overview, we'll be talking about establishing an implementation team for your ICD-10 transition between your office and your Gold Star billers. We will also be talking about the assessment of the impact of ICD-10 on your organization. There are a lot of little areas in your office where ICD-10 is going to have an effect. And one of the things that you need to realize is where those places are, where those hidden places are that will be affected by ICD-10 in your office. Things that you may not have thought about yet, but we do need to discuss. And we'll also talk a little bit about the whole operations aspect of ICD-10 transition, budgeting for the transition, and education and training. And we will finally discuss the testing phase of ICD-10. So just setting the stage for ICD-10, as you all know, on October 1st of this year, the U.S. healthcare system is set to transition to a new diagnostic system. It's actually a new chapter of an old diagnostic system, which is the International Classification of Diseases. We'll be moving to the 10th revision, the clinical modifications, and the question is who is affected by ICD-10? Well, besides your office, and almost everyone in your office will have some effect from the transition to ICD-10, but there are other outside organizations that will be affected by the transition to ICD-10. We talked about that in our previous presentations on how ICD-10 is going to affect data statistics for diseases, for research, and so on and so forth. But really today, what I want to talk about is how is ICD-10 going to affect us? How is it going to affect our offices? How is it going to affect the billers? How is it going to affect your front desk? And believe it or not, there is going to be an effect to the front desk when it comes to ICD-10. Again, things that you may not have really thought about. So what we need to do is realize that now we are less than 80 days away from the ICD-10 transition. And we'll be coming on to 2 months until this transition starting on we're actually less than 60 days away from the transition now. So it's really crunch time. We have to make sure that at this point in time we go full steam ahead with our preparations for the transition, and we have to make sure that your coding professionals, your billers, your providers, and other healthcare professionals within your organization are ready for this ICD-10 transition. So let's talk about some of the things that we need to do and skills that we all need to have to make this ICD-10 transition as smooth as possible for everybody. Number one is we're going to have to break through some assumptions. There was an assumption at one point that ICD-10 was going to be delayed again, and of course that's not the case. So if you're still in that mindset that you think, you kind of got to have your head in the sand because you think this really is not going to happen, man, I tell you what, you need to get your head out of the sand and realize that ICD-10 is happening on October 1st. You also need to look at the big picture of how ICD-10 in the long run is going to help you, help your practice, and actually even help your income by using more specific codes. If we do ICD-10 correctly, if you utilize those codes correctly, there will be fewer claims rejections. Everything will be streamlined to a much higher level than they are right now. Some of us, don't like change, and ICD-10 is probably the biggest change in healthcare billing and revenue cycle management in the last 30 years since ICD-9. The last big change was getting an NPI number, but my goodness, that's one number that everybody had to get, and that was no big deal. And it took years just to get that implemented. It's taken almost 40 years to change from ICD-9 to ICD-10, and of course, a lot of us just kind of wait until the last minute because we don't like the change. But at this point, you're going to need to not only change, but learn how to thrive on that change to ICD-10. Other things that you need to be able to do is to be able to gather your data and improve your processes based on the results that you come up with. Now, what we're going to do is at the end of this class today, and after I've discussed all of these different details that are involved in the implementation of ICD-10 in your office, you need to be able to gather that data and look at how you're going to improve the processes in your office based on the results that you come up with. And finally, the ability to collaborate towards working solutions to the ICD-10 transition. One of the biggest mistakes I think you can make in this ICD-10 transition is handing it over to one person and telling them to take care of it. I don't want to deal with ICD-10. You just do what you have to do. You tell me what to do, and we'll make ICD-10 happen. That's really not going to fly, because even if you assign one person to accomplish that transition, that person is just going to have to turn around and delegate things back to you that you need to be willing to do. So we're going to talk about the whole team concept of ICD-10 and how each person in your office needs to have an involvement in the process of this transition. So what are the first few things we need to do in our offices to assess how ICD-10 is going to affect us? And the first thing that you should do is conduct what's called an impact analysis. And in impact analysis, what we do is we look at all the different operations systems in your office and look at how ICD-10 is going to affect that system. One of the first things that you might want to do just right off the bat is walk into your office as if you're a patient and go to the front desk and ask yourself the question, what am I going to need to change at the front desk to make ICD-10 a reality? And one may be your encounter sheet. So for instance, if you're a medical office or you're a doctor's office and you hand your patients an encounter sheet to take to the back with them, that encounter sheet is going to have to contain ICD-10 codes. That means that you're going to have to reprint all of those encounter sheets or reconfigure all of those encounter sheets to have ICD-10. What if your front desk pre-registers patients and does a pre-consultation to some extent? For instance, they may say something like, well, what's going on today, Mrs. Smith? Oh, you have back pain. Is it going down your leg? Yeah. Is it the right or the left? See, now somebody's going to have to figure out whether you've got right side pain or left side pain because of the laterality. And who is going to do that? Who's going to be responsible for giving you the details as a physician or as a provider, what you need to be able to effectively create an ICD-10 code to the highest level of specificity. That's part of the impact analysis. And those are just a couple of very small examples of how ICD-10 may be impacting your office in ways that you really haven't thought of yet. And you also are going to have to manage that resistance. One of the things that I want you to do when you get back to work today, or if you're off for the rest of the day and you get back to work on Monday, is look at every single person in your organization and ask yourself the question, who is resisting this? Who are the non-believers in the ICD-10 process? Because if you have resistors, those are going to be the people that will create bottlenecks in the whole process, and who could effectively derail the whole process of ICD-10. Again, it's happening. And the thing is if you're a provider and you're listening in on this call and you are the resistor, then you're going to have to get right with God. That's all I can say, is because ICD-10 is happening and you're going to have to make these changes in order to effectively get paid for what you do. If you're, if you're billing insurance claims, we're going to have to use ICD-10 codes. We're going to have to use them right when it comes to October 1st of 2015. Other areas that we need to focus on is education. Let's think about this. If you have people in your office who at this point in time know nothing about ICD-10, it's time to educate them. Let's say we have a lot of chiropractic clinics in here. Let's say, for example, you may think, well, my chiropractic technicians, the ones that do my rehab and my therapy, what do they need to know about ICD-10? Again, a lot of what they're going to do is going to be assessing patients for you on their conditions, and they're going to have to know that laterality is important. They're going to have to know that. And so that's a piece of education that you're going to have to give your therapists on the level of specificity that they're going to need to document for correct ICD-10 coding. We're also going to have to, if you have massage therapists, your massage therapist should be involved in the process of ICD-10 documentation. And there's no way that a coder is going to be able to look at either a physician's note or a therapist's note or a massage therapist's note, and if they're missing the key components of a highly specific ICD-10 code, then you're going to have a world of hurt to be able to code that effectively. So that's another thing that you have to look at, is who in your office at this point in time needs more education on ICD-10 coding so they understand the level of specificity that is involved in both the coding and the documentation process. Another area that you need to focus on in your operations is the business process, what we call a business process analysis. And what I mean by that is, how is ICD-10 going to affect all of the different business processes in your office? I'll give you an example. If you are not ready for ICD-10 and you start submitting claims to a clearinghouse, and let's say you submit 100 claims a week, and all of a sudden you get 80 rejections because your diagnosis codes are not specific enough. How's that going to affect your income over the next few months once ICD-10 is implemented? They are estimating that claims rejections at the clearinghouse level will increase by 50% or more on October 1st. And over time, those should diminish as you learn your ICD-10 coding better and better and better. But the problem is how's that going to affect your income? If you're right now, if you're practicing and you're living month to month and you don't have a reserve income to handle the delays in billing and the delays in reimbursement that could take place as a result of ICD-10, then what's that going to do to your business? How is that going to affect your payroll? I know for myself, I'm quaking in my boots over this because I'll be honest with you, for most of you who are under agreements or contracts with Gold Star Medical, we get paid based on a percentage of collections. We have a few agreements for the smaller practices that are on hourly, but still, what happens if the collections dry up because we're not coding to that highest level of specificity and we're not getting our claims out in a timely manner? Not only are we going to have a way to quickly have claims identified that are rejecting at the clearinghouse level, but quickly be able to fix those and not drag our feet for 2 or 3 weeks fixing diagnosis codes. That's going to have to be done within 24 hours in order for us to be able to get your claims out in as quick a manner as possible to have that turned around and paid. The other thing we're not sure of is what's going to happen when those claims get to the insurance carriers. That's the big unknown right now with ICD-10 is how is this whole process going to work from the cycle of claims taking place and leaving your clinic, going to the clearinghouse, going to the carrier, and then coming back. Are there going to be delays because of reviews of ICD-10 codes? We don't know that yet, but the bottom line is we want to make sure that on our end, we can say that we're doing it right, that there's nothing that's going out of our offices that could delay the claims because of us. We don't want this to be on us. If there's going to be a problem with claims being rejected, we want it to be because it is due to a glitch in the software at the clearinghouse or a glitch at the insurance carrier. We don't want the glitch to start at the source. So we have to make sure that all of our processes are in place and that you're budgeting, and we're going to talk a lot more about that next week when we talk about budgeting and time management for this ICD-10 transition. But right now, we need to analyze where the possible problem areas would be that would cause claims to possibly get stuck. And if they do, when they come back, how are we going to be able to quickly fix those? I mean, I'm just being honest. We're going to take our halos off here. And I have offices where when my billers have claims rejections, and not everybody is like this, but we do. We have offices where we have rejected claims. We send those rejections back to the providers, and it may take 2 or 3 weeks before they get fixed. That's not going to apply on October 1st because it's going to be so much more. So you all are going to have to be absolutely ready to handle that additional work in those first few months to be able to manage the ICD-10 issues that may be coming up within that time period. You have to look at the changes to your super bills. Again, I talked about that a little bit earlier, and what I mean by that is how is ICD-10 going to affect your printed documents? If you have documents right now that are printed with ICD-9 codes on them, you're going to have to change all of those to put your favorite ICD-10 codes. Maybe your cheat sheets need to change. You might have to put little reminders up in your treatment rooms to remember to check for laterality. Just little things that will trigger you to remember to code to a much higher level of specificity. So we have to look at that. The other thing you have to look at is the addition of your IT costs. We have to remember now that there are some software programs out there that right now do not have the ICD-10 codes loaded on to them. And you have to think about the code set itself and the size of the code set. If you have right now 13,000 ICD-9 codes within your software program, and I know you don't use 13,000 codes, but that doesn't mean that, 13,000 codes are still going to be on most of your software programs. And if you're not using a web-based software program, let's say you're using one that you have on your server, and now you run an update and you're going to add 68,000 codes, and that much more space is going to be taken up on your server for that additional code set. What's that going to do to your server? Are your servers at their maximum right now? Are you going to need a bigger server in order to not completely bog down your software and your workstations with all the additional pieces of data that will be involved in ICD-10? Have you thought about that? If you haven't, that's a question that you're going to need to ask your software vendor and your IT people. Can our servers handle the additional data of ICD-10? Man, if your servers are working, if your computers are going slow now, and you do your software update and add all of those ICD-10 codes, it could put them to a standstill. You just don't know. But that's something that you need to analyze before you go ahead and make that transition. Here's just something to think about, that when was the last time you performed a backup of your software? Because what's going to happen is you're going to be asked to update your software to the newest versions with the newest ICD-10 codes on there. And if you try to do that update without backing up your current system and making sure that backup is somewhere secure, you bring in those ICD-10 codes and for some reason your software program has a glitch and that whole program crashes, how are you going to get all your data back? We've had that happen. For those of you who use Eclipse, I've had that happen on 3 different occasions with 3 different clients with just regular software updates. And I had a client in Nebraska, unfortunately, and this was several years back, that ran a routine update to their Eclipse program, and there was a glitch in the update, and they lost all of their patient ledgers, all of them. And they hadn't done a backup in 6 months, so they basically lost 6 months of data. So make sure before you run any updates that you are backing up all of your data. And I mean, these are just, again, little operational things that you've got to be aware of before you run headlong into the ICD-10 transition. You need to do an assessment of what is going to happen with the cost of the increased documentation requirement. And this is a big area. I have medical practices right now and that are looking at hiring scribes to basically follow them from room to room and input their documentation for them as they go along. And they're looking at that as just an increased cost of doing business, but one that will allow them in the long run to be able to generate more revenue. Number one is, as a provider, if I was a provider and I was looking at ICD-10, I would be overwhelmed and I would be thinking right now, how am I going to do this during the day? Am I going to have to take my notes home and work on notes at night? How am I going to do this and be able to see as many patients as I normally see? And I know that on this call, we have people who have very high volume practices. How are you going to keep that volume in the light of the increased documentation that you're going to have? You've got to assess that. That's an area of your operations that you may need to look at and ask yourself, am I going to need to scale back? Am I going to need to hire extra help to help me with this documentation? How is that going to work? And you need to be prepared for, at least in the beginning, if you are not ready with the ICD-10 on your end, and if possibly the carriers and the clearinghouses are not ready, we may see in the first few months marked increases in claims inquiries, denials, and an overall reduction of cash flow. Are you ready for that? I know that myself as a company, I'm preparing for that in the event that we have issues with our clients. But, you know, we need to share that responsibility across the board for your practices and for us as well. Because I need to continue to pay your billers. I pay the billers hourly, regardless of what the collections are. And so we have to make sure, again, that if there's a problem with claims being paid because of this ICD-10 transition, that the problem is not originating with us or with our billers. So what are some of the things that you're going to want to look at it when you're budgeting for your transition? Number one is you're going to want to look at actually building a project budget. And one of the things I have for you that it will be extremely beneficial to all of you at the end of this presentation is a checklist. And this checklist incorporates a project budget. It's how much is it going to cost for instance, for your software update? How much is it going to cost if you need to increase the size of your servers or the speed of your workstation? How much is it going to cost to hire maybe temporary help to manually input your favorite ICD-10 codes into the software system? I'll give you an example. I spoke with a software company right now. I have a client that I do the billing for personally that uses a program called Cairo 8000. And this Cairo 8000 program, it's not that great. So I contacted them. I said, what is the process for transitioning to the ICD-10 codes? And they said, well, we need to update you to the most current version of the software. And I asked them how that was going to affect the size of the software system, so I would know if the server would be able to accommodate that. And then I said, how are we going to upload the ICD-10 codes? And they said, when you do your update, it's going to upload all the ICD-10 codes, and then what you have to do is search for all of the most common codes that you use and build a favorites list. Okay, because otherwise this provider is going to have to be searching through 68,000 codes to find their codes. But there is a place in the software that has a favorites list. Well, how long is it going to take to build that favorites list? How many hours of work is it going to take to map over your 9 to 10 favorite codes? And who is going to do that? So that's part of your project budget. And examples of direct costs that will be involved in the process of changing over to ICD-10. And then we also have to look at the indirect costs, and those indirect costs are the factors that could reduce the cash flow and the revenue to your office. Those indirect costs again may be clearinghouse delays, insurance carrier delays, increases in reviews, increases in requests for documentation to make sure carriers have already been announcing that they are going to increase spot audits to make sure that while the providers may know and learn how to use the higher level of specificity, but the carriers are going to want to see that the documentation matches that. We talked about that last week, is proving your work. So if you start receiving additional requests for documentation and your claims get delayed because of that, how is that going to affect your cash flow and your revenue? And so we need to make sure that you're prepared for that. Another area that we have to focus on is the training plans and assessing the staff training needs. Now, we're way ahead on this, which is it's great. I have been working with our billers for several months now, training them on ICD-10, so you can be assured that they will be ready for ICD-10. The question is, will you, as a provider and as an office, be ready for ICD-10? Do you have, besides these 4 webinars, which are not going to be adequate for you to fully grasp ICD-10, have you scheduled additional training on industry-specific coding for ICD-10? Have you scheduled training for your staff? Have you developed a plan that is going to get everybody trained by October 1st to where they're comfortable enough with ICD-10 to be able to get going with it? And assessing the needs of your staff and which staff members need additional help with ICD-10, and staff includes the providers as well. So this is another focus area that we have to look at from the education and training standpoint. And of course, this is a big one. This is another area that ICD-10 is going to impact you, is the effect on your clinical documentation and the requirements and the review of the guidelines and the current documentation that you have in place. I'm happy to say that we have more of our providers now coming on board with the chart reviews. We've just completed our first few. Dr. Ron is working diligently at them. He gave me the first 2 clients that he completed chart reviews on. And, he's done a very, very thorough job. Now, what I'm going to do is over the weekend, I will be reviewing the same charts, and where he has reviewed the charts from the documentation guidelines and whether you as a provider are documenting to a level of specificity that would justify your ICD-10 codes. I'm going to be looking at it from a billing standpoint, and then between my assessment and his assessment, we'll be sending you a full report on where your deficiencies are. So, the effects of the clinical documentation can be analyzed through the chart reviews that we're offering here at Gold Star Medical. And again, if you have not submitted for chart review, I would strongly encourage you to do that. But if you don't want to do that, then based on your own knowledge of ICD-10, do your own internal audit. And as a matter of fact, compliance is a big buzzword right now, clinical compliance. And part of a good compliance program is internal monitoring and auditing of your documentation and your billing records. And so it's not just an ICD-10 issue, but it's an overall compliance issue that internal audits should be part of your written compliance program and done at least on an annual basis. So it's something that needs to be done regardless of whether you have ICD-10, whether ICD-10 was happening or not. This is a compliance issue. And if you look at the documentation that you have right now, the system that you have in place, you've got to be able to ask yourself, is that documentation adequate? If not, what do I need to do? If I'm handwriting notes and I want to continue to do handwritten notes and I don't want to use an EHR program or an EMR program, how am I going to document to the highest level of specificity? And if I am using an EMR program, does that program allow me to document to the highest level of specificity? How much more time is it going to take? And am I going to need help with this? And like I said, the use of scribes is extremely common in the medical field, in medical specialties. It is not uncommon to have a doctor, to go into a doctor's office nowadays and have a tech basically sitting in the treatment room or following the doctor, going to a computer screen in the treatment room, sitting down and the doctor begins to call out the findings, and the tech enters them into the documentation system and completes the note before the patient leaves the office, or before the patient leaves the treatment room, and before the doctor leaves the treatment room. That allows the doctor then at the end of the day to simply review the documentation and sign the chart notes, which is a very, very cost-effective way to do it. Yes, it does add another staff person possibly to your office, but at the same time, when you assess, the few $1,000s that may be required per month to do that, and you look at the fact that your possible losses could result in tens of thousands of dollars of losses, and on the flip side, that your gains in doing this correctly could result in tens of thousands of dollars in additional revenue for documenting ICD-10 correctly by basically, if you let's say you are a chiropractic office and you're listening in on this and you're thinking, how am I going to make more money with ICD-10? Well, ICD-10 may give you more treatments on a treatment plan. You may be able, using ICD-10 codes to their highest level of specificity, to be able to obtain, if you put a patient on a 24 visit treatment plan and your insurance carrier only authorizes 10, well, with ICD-10, you could very well justify all 24 visits. That's going to make a huge impact on your practice. And if you're a physical therapy clinic, it's the same thing. If you're home health, the same thing. The documentation requirements, and if you utilize the documentation correctly, you could be generating a lot more revenue and actually seeing many more patients and helping them by maximizing your ability to get paid for the services that you perform. So you need to make sure that you are fully aware of the impact that your documentation, your current documentation, and the future documentation requirements have on your practice as we implement ICD-10. And then the last thing that we have to look at is the testing phase. I don't know where you all are with your testing of ICD-10 codes. This is something that we've discussed with the billers. Each of the billers are responsible for knowing what type of testing needs to be done from the point at which the bills leave the practice management software and go through to the carriers. There is a whole bunch of different levels of testing that need to take place. So the question is do you have a plan for testing your ICD-10 claims from start to finish? Have you had that conversation with your vendors, your software vendors, and your clearinghouse on how ICD-10 is going to affect your office? If you are a practitioner here on this call and you have not had a conversation with your biller yet on where they're at with their research on the clearinghouse testing, please have that conversation with them. If they have reached out to you and you have not responded back, please respond back to them so you'll know where you're at with that. But there also needs to be internal testing. And what I mean by that is if you have a software program that maps your ICD codes for you and will map ICD-9 to ICD-10, you need to start testing that to see what that mapping software is giving you. Are they giving you very specific codes when you use the mapping tool, or are they giving you non-specific codes? If they're giving you non-specific codes, then what do you have to do with that software to get them to get that software to supply you with a much more specific ICD-10 code? That's your internal testing. We call that level 1 testing. The external testing is the testing that goes on from the time the claims leave your office or leave your software and go to the clearinghouse and then finally to the carrier. And this is called end-to-end testing. And most software companies and carriers and clearinghouses are conducting extensive end-to-end testing right now. Um, some clearinghouses have closed end-to-end testing, but still will do the testing at least from the software to the clearinghouse to make sure there are no glitches there. Your clearinghouses, if they have conducted and completed all of their end-to-end testing, should have reports available at the clearinghouse level of the results of the end-to-end testing between the software to the carrier, to the clearinghouse to the carrier, and you should be able to review those reports. Uh, and if your clearinghouse is not ready, you need to make sure. We know that, for instance, Office Ally, Gateway, and some of the bigger clearinghouses have conducted extensive testing. Medicare has conducted extensive end-to-end testing, but you may need to test certain carriers, like your software to your Medicaid carrier. Are they ready? Medicaid is, a lot of times, they're behind the eight ball on this. So we've got to make sure that you don't have any glitches in your Medicaid billing that goes out, because for some of us, I can think of some offices here on this call today where they do a lot of Medicaid billing. Well, you better make sure that everything is in order on the testing side of it to ensure that your Medicaid billing is going to go out on October 1 without a hitch. And you need to decide and discuss which transactions you need to be testing. Do you need to be testing, procedure codes? Do you need to be testing your DME codes? Because sometimes DME goes to a different carrier. So you may need to test your DME codes. Which business partners should be included in external testing? Well, your software vendor, your clearinghouse, your billers, and your carriers need to be included in the external testing. So identifying all that is going to be very crucial. And then looking at, if you do have errors that come back, how are we going to fix those? And when we send them back out, will that resolve the problem? So if you do have errors that come back, then you need to take that testing to the next level, fix the errors, and resend them and see if that does the trick for you. So the end-to-end testing is going to be a very, very important process in this ICD-10 transition. And remember that, it's not kind of corny, team is together, everyone achieves more, but it's very, very true. We can't have little islands out there of having one person look at all of these areas of focus in your operations, in your budgeting, in your testing, in your transition, and thinking that one person is going to be able to do it all. It's just not going to happen. So what I'm going to encourage you to do is have a meeting with your staff. And for those of you who have us doing your billing for you, and I believe that's everyone on this call, is include your billers in this process, is have an all-staff phone conference with your biller, with your staff members, to go over the different areas of focus of operations that are necessary to achieve this ICD-10 transition and make it as smooth a transition as possible. What I'm going to do now is I'm going to open the document that I sent you as a handout, and I need to rotate this view over, and just look at this with you. This is something that you can use. I teach this extensively when I go out to teach implementation, transition, and by the way, I basically cut a 6-hour training class into a 45-minute webinar. So there is a lot more to it. But one of the things that the Practice Management Institute, the company that I am contracted to teach with, very graciously allowed me to share this checklist with you. And this comes from PMI's Team Transition seminar, and this is a live seminar that we do at local hospitals all over the country. And let me tell you, for some of us on the call, we have big practices, and we've got some folks on the call that have small practices, but the processes don't change. It's the same for everybody. It's just on what scale do you need to be looking at this at, on a grand scale or on a small scale. So this checklist, I believe, is going to help all of you, and I would encourage you all to go through this checklist together, work on this checklist with your office managers, with your biller, and go through each one of these items. Assign a start date, which if some of you may already have started some of these processes, and if you did, write in the date that you started it and make sure that you have an end date. And of course, you know, until we go through the very last part of this of testing and post implementation, the post implementation part of this on starting on page 5, our end dates here can take place after October 1st. But at this point, every single item on this checklist here is going to have an end date by October 1st and possibly sooner. So you need to be looking at each one of these items with your office manager, with your billers, decide which ones you already have completed. And if you've completed it, mark it off the action plan. If you haven't, go ahead and look at your current staff situation and make sure that your team leader, you should have a team leader, somebody to spearhead the whole transition process. And that team leader is going to be then responsible for delegating the different processes within this checklist to other people in the office. So again, the team leader is not doing it all. They're the quarterback essentially. So they're going to have the ball, and then they need to pass that on to whichever process is necessary to another staff member. And if everybody takes a little piece of it, you'll get it done a lot faster. You'll get the transition completed a whole lot faster. And for some of you, this may be a necessity now, because I know that there are people on this call that basically haven't started anything yet. And we're, like I said, we're, 50, less than 50 days away from the implementation of ICD-10. So we've got to make sure that we go through each of the items on this checklist and decide who is going to be responsible for the different aspects of the ICD-10 training. What I'm going to do now is I am going to unmute everybody, and I'm going to, let me make this a little bit bigger, and I will open this up for questions. I'm going to stop the recording.